similar to kind of the kidney, find your long view of the spleen, elongate it, and then you're basically rocking anterior to posterior, okay? So the first image would be anterior, but you know, acquaint yourself with the spleen and its long view before you determine if you're on the anterior or posterior part. What would be a good landmark to help you know that you're getting the mid part of the spleen? Say it. I heard somebody say it, maybe.
The hilum?
Yes, the hilum. So the hilum looks like what? Vessels? You guys see the vessels? You'll see little vasculature. That helps you know you're mid. And also you're looking at the poles of the spleen. So if I'm getting the longest view, it looks kind of like a crescent shape or a boomerang shape. If I'm oblique, notice how I lose one of those poles and it looks a little fatter and the pole is not as long. So I'm fishtailing the probe at varying angles. If you take your probe and you put it completely coronal, take a little breath. Notice how I lose this superior part of the spleen. So if you're not getting that boomerang shape, that means you're probably not oblique enough. You got to go in between those rib spaces, breathe normal, and be at an oblique plane, because the spleen doesn't lie completely vertical in the body. It's at an angle. So you need to go in between those ribs to get those poles. So this would be a good kind of mid. I can see the little vessels and the hilum there. My poles look pretty long. And now from there, I'm going to kind of rock anterior. I'm going to go back to go forward on her. Take a little breath. So I lose those vessels and the spleen looks a little smaller. So there would be anterior. Mid, breathe. And here's my diaphragm, superior. So I'm gonna go from pole, from tip to tip. Okay, that would be your measurement. I've got my vessels as a landmark and my poles are at its longest point. Okay, so 9.78, spleen measurement, what's normal? 9 to 12, very similar to the kidneys, okay? And then when I go, so you're gonna take one with measurement and one without. Take a little breath. So this would be good without measurement and then one with measurement. So two mid pictures, one with and one without. And then posterior, generally speaking, the spleen gets a little thicker. Often your kidney kind of comes into your space there. So I'm gonna go all the way posterior and all the way back. See how I lose those vessels and it looks a little fatter and not as long. And my kidney is hiding behind there. So that if you see the kidney, you're angled posterior. Okay, so that would be a posterior approach. And then we're gonna do a kidney spleen interface. So again, I'm gonna look for a nice little window. Notice how I'm asking her to take small breaths, because big breaths, you're dealing with the ribs and the air in the thoracic cavity. So if she take a big breath, see what happens here? This is all air. So oftentimes, breathe normal, big deep breaths are not super helpful. You can try it, but if it doesn't work, try small breaths, okay? Or just try different windows. There's some times, just like the kidney, where I actually have to move posterior to get posterior, or move a little anterior. But typically speaking, on a lot of patients, once you find a good spleen window, that's your window. Some people will only have one window for the spleen. Some people you might even have to sit up for the spleen to come down a little bit to get a good view of their spleen, okay? So that's all for your coronal. Now this is where you guys get a little tripped up and everybody kind of is like, oh, it's so weird. I'm going to teach you guys a true axial transverse view of the spleen, how to scan it. I know when you go to clinical, that's not what you do. And your preceptors are gonna be like, don't do that, don't do a Carrie spleen. But I want you guys to understand how to find a long view of something and an axial view of something. To be honest, on the spleen, the most things that they care about is the size of the spleen, the length of the spleen. There is some pathology that can happen, but you can usually see that in a long view. The key is, what I want you guys to understand is finding different parts of a structure and finding its axial view. If you do find say you find a cyst or a tumor on the superior part of the spleen, I want you to be able to go in an axial view and take accurate measurements in an axial plane, okay? So what you're gonna see for the axial or transverse view is not often what you guys are gonna end up doing once you graduate and document it, all right? But go with it here. It helps you with your scanning technique and your learning as to being on the proper part of the spleen. And I don't know, when you think about it, it makes more sense. Carrie's way. Okay, so if this is your long axis of the spleen, then this is superior, this is inferior. So this would be your superior pole, this would be your inferior pole. You guys following me? The mid pole is like, I mean, think of a long view of something. When you go axial, I'm just gonna see this part, I'm just gonna see this part, I'm just gonna see this part, right? It shouldn't just look like that. What did I do? How did I turn the probe? Did I turn it 90 degrees or did I turn it 180? 180. Look at how it looks. The diaphragm, the diaphragm is inferior. Is the diaphragm inferior? No. Right? And it just looks flipped, 180. You guys see my point? No. Okay, is 180 axial?
No.
Axial is 90 degrees. Okay, do you guys understand why I have you do it this way? To understand proper slicing of a structure. Okay, so when you do an axial view, I want you to think of the long view that you have on their spleen, and then I want you to kind of make note of the parts of that person's spleen. Little breath and hold it. So my landmark for upper pole is going to be, what's this?
Diaphragm.
Diaphragm. So I'm going to see a diaphragm, and it's going to look like basically a big chunk of tissue. The transverse axial view of the spleen is not pretty. It's just like blobs of tissue. There's not really a shape to it. You got to use landmarks. So blob of tissue with the diaphragm. Mid typically will be a little bit thicker depending on the shape of their spleen, and you see the hilum. You see more vessels there. And then inferior, you'll often find that the inferior pole is kind of longer. All right, so I'm going to show you how to do that. Now, I would say probably upper pole is the hardest, because when I go upper, I'm just going to get a bunch of air. So if I like move all the way to the upper part, look what I see. So you actually slide down. This is my inferior part. See how that's, if I'm turning my probe, see this is inferior. I turn axial. It's just a little speck of, little blob there. Then I start to go a little higher. See the hilum coming in? And now I'm gonna angle, you're at a very oblique angle. So you actually come lower, the lowest part of the rib, and I'm slicing it pretty oblique. And I'm gonna wait until she breathes. And I'm gonna turn my gain up there. So here is the diaphragm. It's kind of encompassing the bottom part there on your screen. And this would be the upper pole. So it's a little more circular. Is it completely accurately axial? No, because we're coming at a very steep angle to get up superior. All right, but you're actually on the superior part when you see the diaphragm. Okay, now for mid, so my probe is like this underneath the rib. For mid and inferior or lower pole, usually my probe is more perpendicular. I can move mid to inferior. It's just moving superior, you're just gonna get air in between the rib space. Okay, so if you go 180, just twist the probe a little bit and notice how it's getting more axial. If I have the probe to 180, okay, so my my long view was like this on her, my angle. When I go 180, now my notch is down instead of up. Okay, that's why we see it flipped. So then if I scoop my probe a little oblique, I can turn it axial, see there? So then I'm gonna start to come perpendicular here. I can go all the way down, out of it, and then I can get this inferior part. I'll go up a little bit higher. Notice how it looks a little triangular. So here is like triangular in its appearance. This is gonna be mid. See how I can see the vessels here? There is one measurement. It's gonna go from lateral to medial here. You know, I can see tissue all the way to about there. So take one measurement from lateral to medial of the mid pole, and then inferior typically is going to be a little bit longer and skinny. You might see tissue in between multiple ribs. So I've got 3 ribs here, and as she's breathing, see how it's coming in and out of my field of view. So that would be my inferior. So I can always go back to my coronal view and hyper focus on the areas and turn my probe. So if I'm working on inferior, then I come, you know, axial to that all the way out. If I'm working on mid, I come up a little bit higher, and there's my mid kind of triangular shape there for measurement. The superior, like I said, is the one that you have to come at an angle, and it looks a little round. I'm gonna wait for her to breathe, and that would be upper pole. Yes?
So what's it like as far as our depth on those pictures? Do you want it like out?
So like this is accurate. I want to see the diaphragm for upper. For mid, you don't want to cut any of the perspective off. So a happy medium, you might see a little bit of the kidney coming in and out there. You don't, you know, that would be too much depth, right? So just depending on their position, I guess you'd say, I don't know as far as the exact number, just are you using your full field of view? Okay, and are you losing perspective, I guess? Does that help a little bit? Generally speaking, inferior is gonna be the least amount of depth. When you go superior, you're at such an oblique plane, coming lower, coming up. I'm at the same depth. Can I see the whole thing? Can I see the diaphragm? No, so I'm gonna have to increase my depth for the upper pole to be able to reach it. Okay.
Thank you.
Does that answer your question? Okay. Any other questions? No? Are you guys excited to do the kidney and spleen? You got this. It's not that hard. Thank you, Paige.